Yeah, thank you very much. Yeah, my name is Dr. Byram Bridle. I'm a viral immunologist at a university in Canada. And first, I just want to address the question that was just asked. So from a scientific perspective, what I can tell you is after this conference, from my experience of the past 2 years, inevitably, everybody who spoke yesterday will be accused of having disseminated misinformation. I wanted to point out that what I saw yesterday was an awful lot of primary data presented. And when people are accusing us of disseminating misinformation, they never address the primary data that we have presented, nor do they provide primary data to demonstrate that what we have said is incorrect. So in terms of the future, when it comes to science, misinformation is something that we have to be very concerned about. And this, we need the press to help scientists around the world and physicians around the world in this area, because if you aren't aware, there's talks in pretty much every country around the world about the potential to criminalize misinformation. Fine scientists and physicians, fire scientists and physicians if they provide misinformation. This has to be a concern to the media, because you have to start asking yourselves, if that's the case, who are going to be the arbiters of truth if it's not going to be scientists who provide primary data? So that's the key thing you have to watch out for. The other thing is if you are not aware, the mRNA vaccines that were rolled out over the past couple of years, that's just the tip of the iceberg. The same companies are developing mRNA vaccines for other diseases, and you might not be aware there is an enormous number of mRNA vaccines being developed for veterinary use, and that in of itself is also a potential concern to human health. So for example, we know that the mRNA vaccines can get into human breast milk, and therefore we have infants who are consuming undefined doses of these mRNA vaccines. These were never approved for that route of administration, nor to be administered to infants, and yet we now know that is happening. And if it can get into human breast milk, who's to say that they couldn't get into the milk, meat, and eggs that we consume? So I'm telling you, based on what I saw yesterday, there needs to be an immediate moratorium on mRNA vaccine technology until the very many legitimate scientific questions that have come up about this technology over the last 2 years can be definitively answered. And I'd just like to end with this. The thing I most appreciated about my experience yesterday was the fact that these MEPs here, these are heroes to me, and you should not only be proud of them here in Europe, but these are political leaders around the world, I can tell you. So the country that I come from does not allow open discussion about the science underpinning COVID-19, but what was allowed yesterday was uncensored, open, and honest discussion of the hard, objective data underpinning COVID-19 policies, and I would like to thank these MEPs for allowing us to do that.
The World Health Organization wants all countries to sign an agreement on handing over the authority to declare a pandemic, procure vaccine and drugs. It will be healthier and safer for humanity to sign an agreement with the Colombian drug cartel. They know all about the drugs for sure. During the COVID pandemic, World Health Organization only told lies about all things. It should be declared a terroristic organization, and their lives and health of billions of people it putting in their hands, it's extremely dangerous. They lie. That is a new and unknown virus. That is possible to make an effective vaccine. That the vaccine is 82% effective. That it protects against serious illness and deaths. That all, of course, were foolish and lies. Today, World Health Organization is more dangerous organization for humanity than World Economic Forum. Thank you.
If you maybe heard about Brooke Jackson's case in the U.S., she's suing Pfizer under False Claims Act that they defrauded the government. Well, Pfizer already filed motion to dismiss. The case hasn't been dismissed yet, but Pfizer already in court stated that, please dismiss this case, judge. We did not defraud the government. We delivered the fraud that the government ordered.